Hey guys, it's Caroline. For my topic, I was given burn injury. So let's start with how we're going to classify our burn. Well, as we know, burns are like cell destruction. So destruction of the layers of the skin caused by like heat, friction, electricity, radiation, or chemicals. And burns are either going to be small or they're going to be large. If they're small, the burn is more of a localized burn. It's just specific to one area. If it's large or extensive, that would be any burn that is covering more than 25% of an adult's total body surface area, or 10% or more of the total surface body area for a child. And you'll be able to determine the percentage of the body that the burn covers by using the rule of the nines for estimating total body percentage, which I'll show you in just a minute. In addition, there's burn depth. So there's 5 different depths. The most minimal is the superficial thickness burn. That's a burn, an injury just to the epidermis. And the blood supply to the dermis is still intact. The second burn depth, superficial partial thickness burn, that involves injury deeper into the dermis and the blood supply is now reduced. This type of burn, you'll see large blisters that may cover an extensive amount of area. Edema will be present. The burn is painful and sensitive to cold air. And a burn at this level will heal in 10 to 21 days with no scarring. The third depth is going to be deep partial thickness burn. This extends even deeper into the skin's dermis. And at this point, blister formation usually does not occur because the dead tissue layer is thick and sticks to the underlying viable dermis. The surface is going to be red and dry and white in some deeper areas. Number 4, it's getting worse as we go. So full thickness burn. This involves injury and destruction of the epidermis and now the dermis. This wound will not heal on its own and the patient would need grafting. A wound like this is going to appear dry, hard, leathery, waxy white, deep red, yellow, brown, or black. Sensation is reduced or absent because of the nerve ending destruction. The nerves are starting to become destroyed. And then number 5, the worst burn, which I just can't even imagine, deep, full thickness burn. This burn is an injury that extends way beyond the skin. It extends into tissues and muscle, bone, and tendons are damaged. The injured area is going to appear black and sensation is completely absent. There's no pain because the nerves have now been completely destroyed. And something like this would take months to heal, and skin grafts are absolutely going to be required. So going back to how you tell what percentage of the body is burnt, you're going to use the rule of the nines. They call it the rule of the nines because it's denominations of 9. So you would assess where the burn is on the patient's body, and then you would add up the percentages based on where the burns are. So if you have burns on, let's say, the 2 anterior parts of the leg, that would be the left and the right, that would be 18%. And if it went up into the perineum, that's considered 1%. So the total burn would be 19%. 9 for the anterior right limb, 9 for the anterior left limb, up into the perineum, 1%. So 9, 9, and 1, 19%. And again, that's how you would find what percentage of the total body area has burns. There are 4 phases of burns. So you have the resuscitation phase, which is also known as the emergent phase. This has a duration of 48 to 72 hours. It begins at the time of injury. And this is something that would include hospital care or ER care. The primary goal during this phase is to keep a patent airway, administer fluids, because we want to minimize hypovolemic shock, and we want to make sure that we're preserving organ function. Next, we go into the resuscitative stage. Hate these words. So this is where we're going to have the initiation of the fluids, and we are going to do our best to prevent shock. We're going to want to make sure that we have adequate circulating blood volume, and again, maintaining vital organ perfusion. After that, we go into the acute phase. This usually begins after 48 to 72 hours after the time of injury. The focus here is infection control, wound care, wound closure, nutritional support, pain management, and physical therapy. And this phase will continue until the wound closure is achieved. Lastly, we have the rehabilitative phase. So this one overlaps the acute phase, which is stage 3. I think I skipped over that. So stage 3 is the acute stage. This is when a patient is hemodynamically stable, and then this is the phase that's all about the focus of infection control, wound care, wound closure. Sorry about that. After the acute phase, that's when we head into the rehabilitative phase, which, like I said just a second ago, it overlaps the acute phase, and this is the phase that's going to extend outside of the hospital. The goals for this phase is to keep the patient's independence and then achieve maximal functioning. So our nursing to-do list, 1, it's all about the airway. Maintain that patent airways. So we want to focus on our ABCs. We're going to be administering oxygen. We're going to be constantly taking the vitals. We're going to start an IV line and run fluids, again, to prevent hypovolemic shock. We want to elevate the extremity. We want to keep the patient warm. We will put that patient in NPO status. And then we're going to make sure that we do a complete assessment once all of those interventions are underway. So for our treatment, we're going to do pain meds, either orally or IV, depending on where the burn is and the severity of the burn and the patient's pain. Tetanus prophylaxis, also the wound care, whether that's cleansing the wound, debriding the wound, removing the agents that cause the burn. And then after we do that, we're going to make sure that we want to apply an antimicrobial cream and sterile dressing. We'll also, like I mentioned, be doing IV fluid placement because we do not want hypovolemic shock. And again, administering O2. So that's a little bit on burn injuries. Thanks for listening.